So I suggest we have a brief discussion or reactions to these three snapshots that we have had, and then we open the discussion to the public. So these three quick views of mental health and the challenges that are associated with it bring, first of all, the idea that what I presented about the NCCR, the importance of connecting clinical settings with basic neuroscience. And in Switzerland, there is this initiative supported by a public initiative supported by the Swiss National Science Foundation to promote this. And I gave you the example of how the strategic principles are organized to try to connect these two fields. Then I think, Julio, you in a way, you concluded in a similar way, because your vertical and horizontal dimensions connect also basic research and clinical work, but you also opened really a cutting-edge area, which is this connection between the gut and the brain, the microbes in our gut and the brain. I think this is something that will probably develop into something really very important. And then, Sophie, you gave us an example of how a charity can focus and support different levels. Again, in the main question, which is the title of this panel, the challenges and opportunities to connect neuroscience with mental health. So, Julio, maybe I can start with you asking a question. Now, if you were to see where, so we have seen three examples of trying to go into this direction, but where would you see the priority now, where we could maybe move even as fast as possible into something that results in a tangible way in improving the management of psychiatric disorders based on the knowledge of neuroscience?
I think that we have to do two things that are separate and independent one of the other, but they should be done together. One is to optimize existing treatments, which I don't think that they are. And we have a variety of drugs, let's say for schizophrenia, for depression, for bipolar, and they are used essentially randomly. So if you go to if you have depression, you come to me, I'll give you one drug. You go to her, you give another treatment. If that first drug doesn't work, one doctor may add another one, another doctor will switch. So the treatment is very non-standardized. We would not think of treating a cancer patient without following a protocol, or even for diseases that are not so, life-threatening at first, like hypertension. You have a protocol, you have a stepwise approach, and in psychiatry we don't. So I think it's critical that so what's happening clinically in psychiatry is that you have, a multitude of approaches because each person uses his or her own, and then you have a multitude of outcomes, and then it's impossible to know which outcome is due to which approach. So I think we have to be much more standardized in the way we treat patients, and then gradually improve or work towards improving outcomes. Like in cancer, some progress comes because there are new drugs, but even when there are spells that no new drugs are there, the protocols are refined and optimized, and the outcomes keep improving in a way that we don't do in psychiatry. So I think one approach in psychiatry is really to try to improve outcomes with the tools that we have and using them in a more systematic and data-based way. And then I think in parallel, we should, maybe with the support of charities and other sources, try to investigate completely new approaches, which may be where the solution is. And if we don't go there, we may never find it. So I think we have to search for kind of conceptually new ideas, and in parallel, try to optimize what we have.
Sophie, from your perspective of a private charity supporting research, you indicated some of the priorities that you have. So where do you see your impact coming out over the next 2, 3, 4, or 5 years?
I think our impact is very much around bringing all the scientists together. Because at the moment we discussed around that, yes, we need to understand the psychiatry, we move beyond the trial and error approach, the need for neuroscience, but actually we need to go beyond neuroscience. We need to engage with social scientists, educationalists. We need to really actually understand how all of these factors together and bring these people together. I think that one of the things that we need to move away from is response mode funding, such that we're actually building networks and consortia of people working together on the problems, working together on the solutions, to really understand how the illnesses emerge and also how we can change that trajectory. But we really, really need to be looking at this across the spectrum, because I think one of the things that's the intervention may not be at a direct sort of medical intervention. It's important to remember that, for example, the biggest decrease in risk for cancer hasn't come from a medical intervention. It's actually come from a legal intervention in terms of smoking bans. So the intervention to improve psychiatry might not come directly from neuroscience, but actually from something that's happening on the social level. And in response to the need to actually understanding how we need to improve outcomes by understanding what works with whom there, I think this is really where data science can really, really help us, because an individual psychiatrist or psychologist's experience is at the moment what sort of drives that intervention for an individual patient. And it's only looking at by much, much bigger data sets that we're taking into account a whole number of different factors that we can really understand and look at the moderators of outcome and really actually understand what works for whom.
Yes, well, if I may add a third comment on these indications that you gave, and maybe have your reaction. And taking maybe as a starting point the example of cancer, I mean, early diagnosis is absolutely vital, and we probably need much more of this in psychiatry and identifying also patients at risk. Now, there is always the risk of stigmatizing, which is not, which is something that nobody wants to. But on the other hand, it's really a no-brainer for someone, and now it's accepted in the medical practice. If you have high cholesterol, you will go on a diet to prevent development cardiovascular diseases. Cancer, there are all tests now coming up that to try to identify early markers. So if we could go at least in this direction in general in psychiatry, that would probably be something that would be complementary, I think, to the comments that you made. Now, I think we can, we have a few minutes left, and I don't know, Natasha, what you think? We should go on maybe and have questions from the public?
The audience who would like to contribute to this discussion. I've been absolutely staggered by some of the statistics that you highlighted, Sophie. Shocking. But I'm sure other people have been impacted in the same way. Do you want to come to this microphone, sir, if that's all right? Get you doing your daily exercise. Thank you. And if you could start by telling us where you're from. Thank you.
I'm Mario Merlini from the University of Zurich here in Switzerland. I have actually, if I may take the liberty to ask two brief questions.
Please.
They're two very different ones. So the first one relates to the microbiome gut-brain axis. So what is not very clear to me, and what I'm just wondering, if that is a direct effect of the microbiome on the brain, or if there's a microbiome acting on the enteric nervous system, and then the pathways between the enteric nervous system and the central nervous system. So how important is that mediator between those?
So there is, that pathway is there, but we believe that there is also another pathway that's not a direct nervous connection, but are changes both in metabolites that circulate in the bloodstream and also in inflammatory mediators. So those types of effects don't have to be a direct connection from the nerves in the gut to the brain. So if you change immune mediators in the body in a way that affects the brain, you can have an effect like that. So it can be both an effect that's direct through the, in a way it's very similar to the effects of hormones involved in digestion. So when you eat, you have activation of the vagus nerve, but you also have hormones like cholecystokinin and others that then have a central effect. So I think it's a kind of a dual process.
Thank you. So the other question I have, so it's very different. The one is, so psychotherapy plays an important role in treatment of psychiatric disorders, and I think especially in combination with the right treatment. But how much do you think is necessary to really look at a scientific, basically do scientific research into how maybe psychotherapy also can be improved? So besides finding finally good molecular targets, but also finding from a holistic point of view, a psychotherapeutic target. And
yeah, maybe I can comment on this. I think it's a very important question. And well, one idea to connect psychotherapeutic approaches to, let's say, a biological basis of their potential effect is the notion of neuronal plasticity. In fact, the mechanisms of plasticity allow us to learn to integrate experiences in our neuronal networks. And the idea, in a very simplified way, but I think correct way, psychotherapy can also activate mechanisms of plasticity that can actually have an effect on synaptic connections. So, because, you know, a psychotherapeutic intervention will create an experience, will create memories in a way, or interact with existing memories. So, I think one should keep an open mind and keep in mind the possibility that indeed psychotherapeutic intervention in a way change or have an effect on synaptic connections. And by the way, I don't know if she's here, but Helen Mayberg, she's a speaker probably tomorrow, I think. She has made a fantastic study a few years ago comparing patients who were depressed. Half of them, half of them underwent psychotherapy, and another half underwent psychopharmacology approaches, fluoxetine, for example. And and they were imaged before and after treatment to see the pattern of brain activity. And interestingly enough, after a few months, the patterns of brain activity monitored by PET, positron emission tomography, were different in the responders, whether they had been subject to pharmacotherapy or psychotherapy. So somehow, even a psychotherapy changed somehow the neuronal networks, by the way, in a way that was different from how the pharmacotherapy changed. And so I think there is a basis, I think, to discuss and to keep in mind in terms of the biological basis of psychotherapy.
Very interesting. Does that answer your question?
Absolutely.
It does. Okay, good. Don't like there to be disagreements. Anybody else in the audience want to ask a question? There's a couple, actually. Why don't you make your way down, both of you, if you don't mind, at the end of the row? Oh, there's three now. Okay, now we're overwhelmed with questions. Lovely. Whoever gets here first. Thank you very much.
Is Phil Campbell involved?
Thank you.
The one that is involved in Phil Campbell.
Oh, can we put the microphone up? Thank you.
Mine is not a question, it's just a comment to what you just discussed. This could also explain the big problem of placebo effect in trials in psychiatry, what you just mentioned, and explain, you know, the effect of just an intervention on psychiatric patients and the change which could occur in neuronal pathways or neuromechanism in the brain. And I think this has to be considered, that's all.
Okay, thank you very much.
Maybe if I can comment on this comment, I think that what Julio said about the importance of standardized protocols, I think it's really something that is really very important for psychiatry now.
And I think their technology should really teach us how to do it, you know, how to depict the pictures in the best way and reliable way as possible. Thanks.
Thank you.
Thank you for the nice podium discussion. I have actually two questions. One is whether you know which channels are targeted by microbiota, and the second question is whether probiotics, whether do you know whether probiotics have a positive effect on our nervous system?
Interesting.
So I didn't hear the first question. I heard the second one about the...
So whether you know which channels at the level of the gut are targeted.
So that's an area that's being studied right now. So in our own studies, we haven't got there yet, but it's kind of the next step in our proposal. And probiotics do have a role. And there are some treatment trials, particularly for irritable bowel disease, that in which changing the composition of the bacteria has dramatic impact on kind of function and also on mood. So probiotics can be effective. But I think again, they need to be tested very systematically. And there is a lot of I think solid science with science that's not so solid. So I think, the answer is yes, they can have a positive effect, but I think that they have to be carefully tested and have to see which one, works better than another one.
Thank you for that question. Got another two gentlemen coming up now.
You know who I am.
I do.
Sorry.
We're old friends.
Ryan Rudkin again. I live in France through choice. I've been there for over a quarter century. They have, I forget how many hundreds of different types of cheeses. Is that part of the French paradox? I'm sure you'll be able to get funding for research based on the types of food and the fermentation processes, all joking aside, and see how that correlates with quality of life as well as well-being and longevity. Are there any studies that are going in that direction?
To my knowledge, I'm not so sure about the cheese component, but I think it's something that needs to be investigated. And it's one thing that, if you think about, life in industrialized societies, or let's say in big cities, could be US, but could also be Paris, or could be, Tokyo. People have bouts of infection, they take antibiotics, so their flora is periodically completely wiped out. And then after that, or, on part of their ongoing life, they have this very, essentially junk food and highly processed hamburgers and, fast food, etc. So I think that the kind of microbiota that's going to be generated in that kind of person under condition of chronic stress as well, which they have, one thing that people don't realize that chronic stress is not only psychological stress, but physical stress also in the end has the same impact. So ambient light at night is a chronic stress. Noise is a chronic stress. Traffic jam is a chronic stress, and then plus whatever else you have dealing with in your life. So you put a condition of chronic stress with junk food in a gut that has been completely wiped out, it's going to result in a microbiota that I think is going to be very different from someone who lives in a nice part of France and is eating, good cheese and wine, etc. They're going to have different microbiota, and how the impact of that, what's going to be, I think it should be studied.
Okay, thank you very much. Final question from you, then I've got a quick question. Oh, there's another lady. Much more important that you ask a question rather than me. No, you go ahead, sir.
Great.
And then,
So just a question, Gino, you from Hong Kong. Now with interactive media, which influences things at the level of the mind, and with real-time EEG and heart rate variability, what we're able to monitor in real time with Fitbit and the consumer electronics and everything, and with things like sound and light, tactile therapy, current stimulation, magnetic stimulation, transcranial ultrasound, do you see how any potential for these new media technologies and new electronic technologies, how that will impact the treatment of mental health rather than, say, pharmaceuticals?
okay, good, thank you.
Well, maybe I can comment and then let also Julio and Sophie comment. But there are already transcranial magnetic stimulation there have been trials for this, more or less successful. There has been deep brain stimulation for example, a particular form of psychiatric disorders, obsessive compulsive disorders. And I think it's been, I know it's been used also actually based on the studies of Helen Mayberg on for depression, major depression. So there are already some application for it. I don't know if Julio wants to comment.
And one thing that I think is very important with this digital-based technology, and we have a project in that area, is that you can collect information in real time. So if you are collecting, let's say, if you engage with a person and you're collecting mood data or any kind of anxiety data, something like that, prospectively, you can actually kind of catch people before they get into a severe episode. So I think that they can be combined with strategies for early intervention in a way that we typically don't. Like, and we see people people will go to a doctor. When they go a lot, it's like every other week or every month or something like that. And a lot can be happening in that period. And then by the time that they go to the healthcare system, they're really sick and they may need hospitalization or very much more aggressive intervention. So if you have real-time data and can catch people earlier, you could do early intervention before they deteriorate.
Okay.
Sophie?
Do you want to quickly add, Sophie?
Yeah, I think that it's not only in terms of the early intervention, as you say, that I mean the ability to monitor people through mobile devices, their social media uses, etc., is a wonderful way to catch people before they become a bit more severely ill. The other thing is that it offers us a great opportunity for intervention in terms of e-based therapies with squeeze services, that it's under the guidance of a therapist, that this could offer a huge opportunity, particularly for young people, to have intervention at home in their own time under the support of a therapist. But what we really need here is proper engagement potentially with the tech industry. So the gamification for young people of intervention, I think, could be a huge opportunity. But obviously academia doesn't have the kind of funding to be able to put into gamification that can compete with things like Minecraft and the whole gaming industry. And I think that we need to be thinking in different ways about the ways of partnerships with academia and biotech and technology companies.
Okay, thank you. We actually have run out of time, but let's take this question anyway. It better be brilliant.
I'll try and keep it quick. It's a brilliant and progressive-looking session. Emily Holmes, Cambridge, and Karolinska Institutet. If I understand correctly, Julio, both the gut influenced behaviour, but the behaviour influenced the gut.
Yes.
In your model that's vertical and horizontal, how would you represent the behavioural change as a future way of transforming psychiatry and treatments?
Thank you.
Yes. It's not really, was not included in that matrix because it becomes too complicated. But I think that that in terms of that vertical transmission, the behavior has a neuroscience base. So you go from, cells and circuits to behavior and then to diseases and potential interventions. So I think you can create a very nice vertical pathway for behavior.
Thank you very much indeed. Well, thank you for all the questions and all the contributions. Would you like
maybe
to say
just
a final word?
A concluding comment, I think.
Absolutely, please do, yeah.
I think we had 45 minutes to address an immense task, which is and challenge, as the title of the panel mentioned. I think it's important to raise awareness of how mental health needs to be viewed and with really new eyes. We heard some very interesting new approaches. We know, we realize how much connection between neuroscience and clinical psychiatry is important. And also with the technology. I think we had a very interesting question about digital technologies can help in getting information and following patients. So it's really a very broad field, but which is a real challenge that society has to face over the next few years.
Indeed so, a very inspiring session. Thank you very much indeed to Professor Magistretti, thank you. Also to Professor Julio Licino and Dr. Sophie Dix.